So thank you very much, Pamela, for being here. For those who don't know Pamela Fralick, Pamela is the President and CEO of Innovative Medicines Canada, and actually the former President and CEO of the Canadian Cancer Society. So you bring a tremendous amount of experience to the table, not only for Innovative Medicines Canada, but for patients as a whole across this country. Thank you for taking the time to meet with me and to discuss a few of the issues that are on the table, particularly as a consequence of the pandemic, and really giving us a bit of the industry point of view and how that affects all of us, whether we're in industry or patients or citizens in general right across Canada. So with that, I really want to really get right into it and ask you about the pandemic. We all know that the pandemic has put an incredible amount of strain on our healthcare systems, hospital infrastructure. Cancer patients have been seeking care, who have been seeking care, have had diagnostic tests delayed and surgeries put on hold. Clinical trials were interrupted, to mention just a few of the ways that patients have been impacted across the country. What do you think, or what do you feel are the most important lessons that industry has learned from the impact of the pandemic on all Canadians?
Well, thanks for starting with the easy questions, Barry. Let me, though, just before I dive into that, just acknowledge you, your organization, all of the patients that you represent. You know, the issues that you deal with on a regular basis can feel pretty overwhelming. And trying to do so during the pandemic has really taken extra fortitude. So I just want to acknowledge the work that you have been doing on, as I say, on behalf of your members and all the patients that are out there looking for your leadership. Basically, it's not been an easy time for anyone. And if I can add, just on a personal note, I do have a very special friend who was diagnosed with colorectal cancer at 48 and 18 months later was gone. And so I just applaud the work that you do, raising awareness, getting earlier diagnostics, getting better treatments. It's just such a pleasure to be here with you. So thanks for that invitation.
Thank you.
Now back to your question. To your question, though, and it is a big one. And I've been reflecting on this because I assumed there would be something of that nature. And for me, the big word is resilience from lessons learned. And keeping in mind that we're still in the pandemic, of course, and there'll be a lot more opportunities to assess what we've learned and what we do with that. But it's how essential, how important resilience is going forward. And I'm not talking only about the individual resilience that I was probably referring to a moment ago, but it's the resilience of our health systems. It's something that's so important to me, to our industry, to you, I'm sure. And I did just a little bit of reflection before entering into this chat. And the World Health Organization has a body, a European observatory that's looking into health systems and policies. And I want to just read this one sentence for you to make sure I get it right. They have defined health system resilience. It's the ability to prepare for, to manage, and by manage they mean absorb, adapt, and transform, and learn from shocks. What's a shock, you ask? It's a sudden and extreme change which impacts on a health system and is thus different from the predictable and enduring health system stresses such as population aging. So, reflecting on that and looking at Canada and what we've learned, well, we weren't prepared. Whether it was PPEs at the beginning, healthcare professionals, we simply have not had the capacity. We weren't prepared. And what perhaps causes all of us even more chagrin is that, we didn't adapt and adopt from earlier crises. We lived through SARS, H1N1, reports were written, recommendations were made. We could have prepared better and we didn't. So that's one learning that I hope we keep with us going forward. This whole shock cycle that the WHO talks about has 4 stages. The last one is recovery and learning. So I'm really hoping that that's where we are right now. We're starting to recover, but we definitely will learn. And I wanted just also to draw on the research they've been doing to identify a couple of the strategies that they really have culled from all the research, all the experiences we've had globally. What should Canada be looking to do as we move forward? Well, one is about governance, really having good leadership during crises, having a vision, being coordinated, good information flow, all of those pieces, monitoring, evaluating the impact of the shock. So governance, a big issue. Financing, we've heard so much about that in Canada, right? And I think we've probably done not so bad in that regard, but able to have the flexibility to reallocate funds, inject new funds, this kind of thing. And then a third, I've got four I wanted to mention, but the third is resources, broadly speaking. So human resources and physical plant. And that, well, I won't start evaluating us, but it's really about increasing our capacity so we can respond to these surges in demand that we've experienced. And that, you know, it's allowed us for the most part to deal with COVID-19, but as you cited right off the top, has not allowed us to keep up with the regular and ongoing care that we need. The last one is really about service delivery and making sure as a health system that we are able to be flexible and adapt and provide different ways of delivering services. So a good example in Canada is how pharmacists were asked to step to the plate to provide vaccinations and really allowed us to deploy into a lot of communities. So a real work in progress. Let's just hope that we learn from our previous and our current situation going forward.
Oh, I really like that last part that you're concluding on in terms of learning, because it's not just about resilience, being more resilient to a pandemic. It's really about building back better, right? It's having a stronger system than we had before the pandemic and really realizing what we can do. And that, as you mentioned, does require investment in different ways. What do you think the industry could do in the short term, at least, to help build back better our healthcare infrastructure? Is it, as you mentioned, perhaps working with pharmacists? Is it public-private partnerships? Or what other ideas might you have from the industry's point of view?
Yeah, those examples that you're giving lead me to my first observation, which would be around collaboration. And industry is keen to collaborate with patient groups, with governments. And it's been one of the success stories, I think, that has emerged from the pandemic. Certainly the industry-government relationship at the federal level has had its tensions, and yet we're able to put those aside during the pandemic and create some true good outcomes for Canadian patients, and we want that to continue. So that is something that industry wants to do more of. Another piece might be around value and really translating the industry's value add to Canadian patients, to Canada, not just in terms of health, but also the economic well-being. I think there's been such a focus in the years I've been involved with the industry on the cost side of the industry that the value is being lost. And cost, yes, must be addressed, but let's not lose sight of the long-term value that an industry can contribute to. So that's part of building back better. HR, the industry has been extremely supportive through its patient support programs and its health professionals. Industry actually addresses some gaps that government has been unable to address, and you'd be well aware of this, and most patient groups are. So that has continued through the pandemic and will also continue beyond the pandemic, assuming we get out. And the last thing perhaps I'd mention, well, one other thing, but access. We need access to the best medicines as quickly as possible. So our access system is not particularly efficient, and I won't go through details. We can if you'd like, but that's something that industry really wants to be part of those conversations and contribute to the access pathways.
Well, absolutely. I mean, I think this is something that we're highly focused on at Colorectal Cancer Canada and other groups as well.
Yeah.
In terms of earlier access to some, for example, the new precision medicines.
Our challenge in Canada is, of course, we have multiple systems, health systems. We have provincial and federal, probably depending on how you count, 14 or 15 altogether. And they like to do their own thing. And so that makes it challenging. So I come back to the collaborate, build some trust, and let's have our roll up the sleeves conversation to figure out how to make that happen.
So what does a more resilient healthcare system look like to you from the industry perspective in the next 10 years to come?
I love that question. And it gives me the opportunity to focus in on what is commonly known as patient centricity. Although I would say quickly thereafter, what do we really mean by that phrase? How do we ensure it's embedded in everything we do? How do we make sure that in another 10 years, we're no longer having to ask those same questions? So that ability to really integrate the patient perspective into everything we do, not give it lip service, to me is a driver for how I see the health system resiliency growing in the next 10 years. And I have a little wish list here. I won't go through it all, but if you'll allow me to mention maybe 3 or 4 quickly, you'll get a sense, I guess, of where I'm going with this. So first and foremost, for patient centricity would be that patients have access to medicines in the same timeline as other comparable countries do. Seems like a simple wish, but it's tough in this country. We're currently 18th out of the top 20 OECD countries. So we can do better there for sure. Maybe not even in 10 years, maybe in 2 or 3, but let's put it within that 10-year time frame. Secondly, we talked a bit about data. So patient health records being digitized and having patient access already happening in other countries. Denmark, the Netherlands, I think, is moving in that direction as well. So why can't we have 100% of Canadian patients digitized with their records and having access to them? We haven't talked a lot, and I don't hear it as much, but average life expectancy is a typical metric. And so we're 15th at the moment. So can't we be top 10 in life expectancy? It's Canada after all. And another one would be around we've talked throughout this chat about high performing health systems. There was quite a difficult report out of the Commonwealth Fund just recently, a few weeks back, that put us at 10th of 11 peer countries. So can we move ourselves up? I know that one's a tricky one, but at least move up a few places. So I have others, but I will stop there. And I think if we were to accomplish those fairly concrete but doable things over the next 5 to 10 years, that would build a tremendous amount of resiliency into our health system. And it will, the more we focus on getting access to the innovative drugs as quickly as possible, that keeps people healthy. It keeps them out of the health system. It leaves more resources to deal with the sorts of emergencies that we're dealing with right now. So it just makes sense.
Well, thank you so much for taking this time with me, Pamela. I really appreciate it, as do everybody who is gathering information as we pursue our goal to create a more resilient healthcare system in Canada and health solutions for all Canadians, and in particular for patients. And as we like to say at Colorectal Cancer Canada, we're ready for the next round. So thank you so much for this.
Thank you for the time and the privilege to speak with you, Barry. Best of luck to you and your group as well.
Thank you.